Hello, welcome to my YouTube channel. I am Dr. Hassan. So today I am going to discuss an important topic which I have promised you guys in my earlier videos. So the prescription station is one of the most important station usually encountered in UK Malay 2 or Plab 2. Usually the prescription letter you in the UK is different from the prescription in other countries. So that's why uh, the purpose of the prescription station is to understand about the prescription in the UK. So if you are worried about prescription for your UK relative, so we will discuss the prescription letter in detail. So usually in UK relative, they assess you on three things: data gathering, management, and IPS. So what is data gathering in prescription, what is management in prescription, and what is IPS in prescription? And the last question is that this is one of the most controversial statement: is it necessary to open BNF inside of your exam queue? So I will answer this in later on. So I will start each and everything regarding prescription. So you have to watch this video from starting till end. So I am going to share another screen with you guys. So here we go. Here we So there are these different prescription sheets I have just collected for you guys, which usually appear in your exam. Inside of cubicle, you can find these prescription letters. So it is different in different trust of NHS, but usually in UK military exam, they keep these prescription letters. Okay, this is adult intravenous fluid prescription chart. This is usually they keep separate. Okay, and this is the child prescription for fluid. This is also placed in separate section, and this is syringe driver, and the all the three charts, prescription charts, you can find separately from the main prescription letter inside your cube. So be very careful while having uh, writing the prescription letter if you are having some fluid management in adult or in children, or if you have prescription for your syringe driver, they usually you can find in separately. So keep in this mind. So come to the full prescription letter, which you can find inside of your cubicle, is this one. Sorry. So this is the first page. Okay, and in the second page, this is just for antibiotics. You have to write antibiotics over here. And on the third page, this is regular, because regular medication usually um, more in quantity, so that's why they keep two pages for regular medication. Okay, and at the end it is as required or PNR sheet. Okay, you have to write the PNR medication on this chart. Okay, so let's start from beginning. So we have just discussed earlier what is IPS, what is data gathering, what is management in your prescription letter. So you can see that from on the first page, what you can see the patient identification or identification level here, our right side of upper corner. Okay, and on the left side, you can see that ward, hospital, consultant name, and date of admission, weight, height, date of re-return, and date of return chart. dash of dash. Okay, just below, has the VTE risk assessment form been completed? There's a box here, and the for allergy center section, you have to write the medication over here, and your name here, your signature here, and the date here. If he has any rash, for example, mm, any type of reaction, for example, rash, you have to write either rash, anaphylaxis, whatever is, you have to write over here. Okay, just below this, there's another part which is called MRSA or MSSA. Usually, this MRSA is your task. Please tick if patient has any following of Clostridium difficile. You have to tick on the MRSA box. Okay, and in the first page, you have to write the once only and pre-medication, which is the loading dose of any medication. You have to write over this page. Okay, and you have to write the date, the time, the drug name, the route, dose, and sign in your bleep number. Okay, and you can skip all these 4 boxes. And at the end, there's oxygen. If patient is on oxygen or he is being prescribed with oxygen, you have to mention the oxygen, whatever. For example, you have to give him via Venturi mask. You have to encircle this one. Via non-reactive mask, you have to encircle this one. Okay, so if other, for example, nasal prongs, you have to write over here nasal prongs. Okay, and for if it is BD morning and evening, if it is TDS, you have to encircle these 3 things. Okay, and then your name, bleep, and starting date and stopping date, you have to write over here. Okay, so come to second page. This is just for antibiotics. So you have to write antibiotic here. You have to write dose, route, starting date, stopping date here. Okay. What you have to do is that you have to write the dates over here. Okay. For example, it's 5th of June, 6th of June, 7th of June, 8th of June, and so on. And you have to write time here. If it is OD, you have to just write 8:00 a.m. or just you can write 8:00. Okay, if it is PD, you have to write over here and over there. If it is TDS, you have to fill 3, and if it is QID, then you have to make 4 boxes accordingly. I think you guys are following me. So remaining all of the boxes are same. Okay, and for a regular medication, this is third page. Another important thing is that there's another patient identification level here and ward hospital detail over here. So you have to keep in mind that there are usually 2 pages you have to write the details or affix the patient detail, which is the first page and the second page. In case you have to write fluid prescription or syringe driver, you have to use 3 identification level or the prescription chart. Okay, which I will show. That is here. Okay, you have to affix here if you have to prescribe syringe driver prescription, and the details over here. So, and similar for fluid prescription. So guys, there are 3 identification levels. If you have to write syringe driver, child fluid, or adult fluid prescription. Otherwise, you have to write on 2 pages. This is must. I will discuss later on why this is must. Okay, then coming to the regular medication. Okay, all of regular medication will be right on these pages. Similar to the above, you have to write drug, dose, route, starting date, and stop date, and your signature, bleep number, additional information if there is. Okay? And the last thing is the as required PNR. So PNR, for example, it is morphine, indication for pain, dose, IV, IM, subcutaneous, parolar, road, frequency, QID, TDS, maximum prescriptions, prescriber signature, and name clearly. Okay, the date and the bleep and any additional information. For example, if you have to stop in after 5 days, or if is pain free, then you can write stop after having mm, pain free condition, for example. Okay, so this is just a general overview of the prescription letter. Okay, so let's come to our main topic, so which is what is IPS in prescription letter. Okay, the IPS is so simple. So in prescription, what is IPS? IPS means that you have good communication in other station. You have good communication, eye contact, smiley face, all these things are count in your IPS. So in prescription letter, if you write clearly and neatly, this is your IPS. Whatever you write, for example, if you write consultant name or hospital name, you should be very clearly write over here. This is just your IPS. Wherever you have to write anything, you should be keep it neat and clean. This is our IPS. Okay, and what is data gathering? Data gathering is most important thing in the prescription. So for data gathering, I told you earlier there are 3 pages you have to fill: patient identification label or the hospital detail. If you have to prescribe syringe driver, you have, or prescription of child fluid or prescription of adult fluid, you have to write on 3 pages. Most of these doctors, what they do is that they just fill the first page, the patient identification on the first page, and they left the other 2 parts or 1 part if they don't have any other like prescription of syringe driver or fluid prescription. So it is very necessary to fill all the 2 pages for identification, patient identification and the hospital identification. First is on the first page, the second one is on the um, third page. Okay, and third page over here, and the third is on the prescription of syringe driver or prescription of fluid. You can see that over here you have to write the consultant name, the hospital name. Okay, so you have to must write these on these 3 pages if you have additional prescription. Okay, so all these come under your data gathering. Okay, data gathering is most important thing. So you have to write each and everything about patient detail, about hospital detail in every section. You don't have any choice to left F1 or 2 pages. Just you have to write all the required identification places. So the second thing is that the first pages was most important thing. Okay, you have to write each and everything. For example, if you don't have any allergy, you should write NKA. Okay, your name should be right over here very clearly and precisely. Your signature and date, this is most important thing. If patient has MRSA, you have to tick on over here. If you don't do this, your marks in data gathering will be deducted. Okay, and now comes to management part. What is management part? Management part is just they will um, ask for something to prescribe. So for example, if patient is taking antibiotics, statins, and the doctor is just advised you to prescribe clarithromycin. So what is your main task is here, you have to write clarithromycin on antibiotic section. Okay, for antibiotic section here, you will have to write clarithromycin for 5 days. per oral, starting date and stop date, and all the relevant boxes you should be filled. And then after this, what you have to do is that you will, you will go to the recommendation over here, name of the statin over here, and the dose, route, all the thing you should write over here. And then for 5 days you should have to stop the statin. You can make a single straight line over here, or you can just cross it out just like this way. Okay, cross for 5 books. And then in additional information you will say that withhold statin for 5 days. This is additional. So your task is completed here. If you don't have time to write other medication, you will still pass with good marks. If you complete the other medication as well, then you will get full marks in this prescription letter. So what is the main task? Main task you are having to write. For example, the main task is just like there are in pain patient, in palliative care patient, you just have to go to over here. On the prescription letter, they advise you to give some paracetamol and statin through oral. So you will have to avoid give them in orally, and then you should go to the as quiet part, and you should start morphine, cyclizine, whatever is. You should complete this one. And in addition to that, they also prescribe some syringe driver for pain breakthrough medication. So for example, you have to paste patient detail over here, and then the other detail over here. Then you will have to write the name of the pain of the medicine here. For example, morphine dose, whatever dose, subcutaneous, and diluent, what for diluent, and starting date, and your signature over here. So this is your main task. So if you fill the both pages, the one is as required and the second one is this one, so you can get maximum marks for your management part. Okay, so what is IPS? IPS is just to write clearly whatever you write. In the first page you should have to tick the boxes and make sure that the allergy center section on the first page you don't miss it, and write your name accurately, and signature and date here. Okay, and this is just IPS. What is data gathering? Data gathering means that you have to write, you have to make sure that you level all the required data of patient and hospital in every section, not in just on the first page. Okay, this is your data gathering. And the fourth thing is management. Management is what is actually told you to do, is that they will check assess some medication, for example some drug interaction or fluid prescription or palliative care treatment. So it could be 3 or 4 sections that they usually assess. It's up to you. And there are totally 40, around 40 prescription letter up till now. The GMC has released in Ukmla 2 and Plab 2. You have to practice those. You don't need to go beyond those 40 prescriptions. So you and do we need to open the BNF? It is not necessary that you need to open to BNF. Some told that if you don't open BNF, you will fail. It is not possible that you will fail just not opening of BNF, because if there's new medication and all the things new, a consultant in NHS cannot do prescription letter in 8 minutes. So this is non-realistic. So if you can remember each and everything, you don't need to open BNF, because I didn't open BNF in my queue, and the examiner was in front of me, and still I get 11 out of 12 in prescription letter. So there are few people who prepare for prescription letter. I would recommend you should go through their sessions. That would be useful for you guys. So hopefully you get useful this session. If you have any queries regarding your prescription, you can comment down below, and please subscribe my channel, and forward it to your friends for more useful topics related to Plab to UKMLA or Irish Medical Council. And if you need this prescription letter in PDF form, you can also comment below in comment box. Thank you so much for bearing with me, and I hope this session was useful for all of you. Thank you so much.